In our research, we use eye movement monitoring to investigate memory. So we track people's eye movements as they look around a visual display. Where people look, when, and for how long is really heavily influenced by what we remember. Using this technology, we can see what types of memory representations are intact as we age or have brain damage, and those kinds of memory representations that seem to be impaired with the aging process or with certain types of brain lesions. So for instance, we can determine whether you've seen a particular person before. We can also determine whether you have memory for how objects should be located within an office scene and whether you detect any changes within those environments. We like using this technique because we don't have to ask people what they remember, but we can just use their eye movements to actually tell us what they remember, even when they have no conscious awareness for what is actually contained within their memories. We had a really interesting recent finding with one of our amnesic individuals who comes in time to time for testing. So he was able to perform normally on a test that by all accounts, he should not have been able to succeed on. And that was really interesting for us because we were able to then try to explore what his strategy was in succeeding. And we were able to really learn from him in a very interesting way, in a way that we didn't set out to explore. We then tried to discern what his strategy was and to document it, and then to try to teach it to other amnesic individuals and also to other older adults who are having difficulties with their memory. And what we're seeing is that these folks can use this strategy in some cases to prop up their memory performance. So just by paying attention and listening to this amnesic individual, we were able to learn something really new about memory that we just had no idea existed.